What is the most common medical emergency that takes place in the dental office? If you said syncope or fainting, then you're correct. And most providers are going to have to deal with this medical emergency more than once in their career. What's happening in the body when somebody faints? Well, it's a drop in blood pressure and heart rate that causes a loss of consciousness. And we're going to talk about two types that are most common. The first type is vasovagal syncope. So this happens as a response to stress, and it's usually because of somebody's fear of a needle and the injection. It gets its name because of the feeling that is oriented inside the vagus cranial nerve number 10. For most people, we're going to place the patient in a Trendelenburg position. This is where the feet are elevated, and our goal is to try to get the head lower than the heart. If they're in an operative chair, this is easily achieved. For patients that are pregnant, they're going to be put in a different position. They're going to be put in left lateral decubitus, a position where their left side is down and the right side is elevated. What this does is it prevents the baby from putting pressure on the inferior vena cava that runs along the back towards the right side. If positioning the patient doesn't return their consciousness, then we can use an ammonia inhalant, a respiratory stimulant, to see if that will wake the person up. It's a good idea to have these placed inside each operatory that's easy to get to, because remember, this is the most common medical emergency that's going to take place. Some people like to tape it to the arm of the light. For an ammonia inhalant that has not been used, it'll have still a white packaging. Once you've cracked and activated the ammonia inhalant, you're going to place it under the patient's nose. This respiratory stimulant should wake the patient up. I'm going to demonstrate next how to crack one of these, and you'll notice a color change that takes place. It's cold to the touch and changes colors. If you ever notice an ammonia inhalant that has any discoloration or a pink hue, it may not be as effective. Go ahead and discard that packet and get a new one. If you remember, we mentioned that there's two types of syncope. The other type of syncope is called orthostatic hypertension. This still happens when a person has a change of blood pressure and heart rate, but it's not a result of stress. It's a result of a quick change in body position. What happens most frequently is the patient has been reclined back for a long procedure, and then they go from a reclined position to a standing position with not a lot of rest in between. This causes a failure of the baroreceptor reflex that mediates the peripheral resistance. Orthostatic hypertension is more likely to happen if the patient is dehydrated. In response to this medical emergency, once the patient has regained consciousness, you're going to have them sit in an upright position and administer oxygen with either a nasal cannula or a mask for 15 minutes and monitor their vital signs. It's important to know that if somebody has fainted, they're really not fully recovered for many hours after they faint. It's a good idea to advise them to find alternative transportation if they were the one that drove themselves to the appointment. If the person has a complex medical history or seems really bothered by the episode that they just had, you can still offer to call EMS for an evaluation. And lastly, even if the patient's consciousness is restored, it's still best to discontinue the services and reschedule them for another time.